Hello everyone. In this video, I am showing flowcharts on scalp, face, chapters in the head and neck region. After reading scalp, face regions from the textbook, you can go through all these flowcharts. So through these flowcharts, total chapter can be understandable at a glance. So these charts will help you for quick revision before exam, and you can remember easily the chart through these charts the total chapter, and you can take screenshots of these flowcharts for further reference. So we'll see that flowcharts. So scalp extent of the scalp is by anteriorly supraorbital margin, posteriorly external occipital protuberance and superior nuchal lines, on each side by the zygomatic arch. The layers, there are layers of the scalp. First layer skin, second subcutaneous connective tissue, third is the epicranial aponeurosis, fourth is the loose areolar tissue and pericranium. And arterial supply of the scalp is by supratrochlear, supraorbital, superficial temporal, posterauricular, and occipital artery. The nerve supply of this scalp is divided into in front of the auricle and behind the auricle, and in front again divides into sensory and motor supply. Sensory branches are by supratrochlear, supraorbital, zygomatico-temporal, auriculotemporal, motor by temporal branch of the facial nerve. Behind the auricle, greater auricular nerves, lesser occipital, greater occipital, third occipital. Motor branches by posterior auricular branch of the facial nerve. And this clinical anatomy of this scalp by sebaceous cysts and surgical layers of the scalp. The first three layers, that is skin, subcutaneous connective tissue and epicranial aponeurosis. These three layers together we call surgical layers of the scalp. And black eye, dangerous area of the scalp, safety valve of the hematoma, cephalohematoma, caput succedaneum, scalp wounds bleeding, gaping wounds of the scalp. So these are all clinical anatomy of the scalp. So description of layers of the scalp. So first layer, it is that skin. It is it contain hair. It is adherent to epicranial aponeurosis. It contains numerous hair follicles and sebaceous glands. Second is the subcutaneous connective tissue. It is known as the superficial fascia. It is contains dense connective tissue, and it contains passage of the blood vessels and nerves. Third is epicranial aponeurosis. It also called Calia aponeurotica, and it gives insertion to frontalis and occipitalis muscles. The fourth layer we call it is loose areolar tissue. It is anteriorly extends into the upper eyelid, posteriorly extends up to the superior nuchal line and gives passage to the emissary veins. So these emissary veins equalize the pressure from extracranium to intracranium, and also it spreads the infection from extracranium to intracranium. That's why this fourth layer, loose areolar tissue, we call dangerous layer of scalp. Fifth layer we call pericranium. It loosely attaches to the bones. And now coming to flowcharts on muscles of the face. The muscles of the face, facial expression is divided into six groups. Number one, on the scalp, it is occipitofrontalis. Number two, around the orbit, corrugator supercilii and orbicularis oculi. Around the nose, procerus, compressor nares, dilator nares, depressor septi. Around the lips, orbicularis oris, buccinator, levator labii superioris, aliquinaceae, zygomaticus major, minor, levator labii superioris, levator anguli oris, depressor anguli oris, depressor labii inferioris, mentalis, and risorius. Around the auricle, we have auricularis anterior, auricularis posterior, auricularis superior, and neck muscle we call platysma. Description of the platysma: it is a superficial muscle known as the subcutaneous muscle. It is representing that panniculus carnosus embryologically develops from second pharyngeal arch. It arising from the fascia covering pectoralis major and deltoid muscles, and insertion by base of the mandible. It's supplied by cervical branch of the facial nerve, and it depression of the mandible and oblique wrinkling of the skin and neck. It pulls the angle of the mouth downwards and laterally, and it facilitates the venous return. This is about the platysma muscle. Sensory nerve supply of the face by ophthalmic nerve, maxillary nerve, mandibular nerve, and cervical nerves. So, ophthalmic, maxillary, mandible nerves, these are the branches of the trigeminal nerve. And ophthalmic nerves through supratrochlear, supraorbital, lacrimal, infratrochlear, external nasal branches. Through maxillary nerve, infraorbital, zygomaticofacial, zygomaticotemporal branches, and auriculotemporal, buccal, and mental branches of the mandibular nerve, and great auricular, transverse cutaneous nerve of the neck, lesser occipital, and supraclavicular branches of the cervical nerves. So, this sensory nerves now by trigeminal nerve, that's why the clinical anatomy of this face is trigeminal neuralgia. Facial artery flow charts. It begins from that external carotid artery in the carotid triangle, arises at the level of greater conure of hyoid bone. It terminates at that angle of the mandible as a angular artery. Its course is it winds around the base of the mandible and runs obliquely in the face towards the medial angle of the eye, and it is tortuous in course. Its branches are inferior labial, superior labial, lateral nasal, and angular branches. So, the clinical anatomy of facial artery is the pulsations of facial artery at the base of the masseter along the anteroinferior angle of the masseter are 1.25 centimeter lateral to the angle of mouth can be feel. Next flow charts on the lacrimal apparatus. Parts of the lacrimal apparatus. Number one, it is a lacrimal gland, and number two, conjunctival sac. Number three, lacrimal puncta and canaliculi, and lacrimal sac, nasolacrimal duct. Lacrimal glands are the J shape, and they are two parts, orbital and palpebral parts. From here, the ducts opens into the conjunctival sac. Conjunctival sac lies between palpebral and bulbar conjunctiva. And from the lacrimal sac, lacrimal puncta, lacrimal canaliculi present, and it opens into the lacrimal sac. Lacrimal sac is a fibroelastic sac, and it lies in lacrimal fossa. It continues downwards as nasolacrimal duct. Nasolacrimal duct is 18 mm in long, and it downwards, backwards, laterally opens into the inferior meatus of the lateral wall of the nose, and it is guarded by valve of Hasner. These are the parts of the lacrimal apparatus. Nerve supply of the lacrimal gland. It is having sensory nerve supply, sympathetic and parasympathetic. Sensory by the lacrimal nerve, and sympathetic fibers are vasomotor, parasympathetic fibers are secretomotor. The description of this nerve supply is given in this flow chart. You can go through, and there is nerves supplying these sympathetic, parasympathetic are given in this flow chart. So if you like this video, like and share this video. Thank you for listening.